It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can have peace of mind, real power, real control, and so that you can influence decision making fast even if you're not a doctor or a nurse in intensive care. In last week's blog I talked about the first part of the IntensiveCareHotline.com 3-part mini-series, Critical Lessons for Families of Critically Ill Patients in Intensive Care, Part 1. Part 1 of this mini-series was about intensive care is a multi-billion-dollar per year industry. You can check out the first part of this IntensiveCareHotline.com mini-series if you're clicking on the link below this video. In this week's second part of the IntensiveCareHotline.com 3-part mini-series, I want to continue with Part 2 of Critical Lessons for Families of Critically Ill Patients in Intensive Care, Part 2. In Part 2 of the IntensiveCareHotline.com mini-series, I want to share with you what's happening behind the scenes in intensive care is way too powerful to not impact on your critically ill loved one. So, you may wonder, why do I do this IntensiveCareHotline.com 3-part mini-series? I do that because I learned and still learn many valuable lessons that I have learned in more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families. I have also worked as a nurse unit manager in intensive care for more than 5 years, and I have learned so many lessons. I have seen so many things happening behind the scenes in intensive care that I really feel an obligation to share my intimate knowledge with families of critically ill patients in intensive care. There's literally no situation that I haven't come across, and there's no question that I can't answer. In the next and last part of the IntensiveCareHotline.com 3-part mini-series that I will send out over the next few weeks. So, keep watching the space. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "We don't know what we don't know, and if life is throwing you a literal curveball, such as when your loved one is critically ill in intensive care, you can't ignore reality." Ignoring reality when your loved one is critically ill in intensive care will get you directly in the 99% zone of the families of critically ill patients in intensive care who have no peace of mind, no power, no control, and no influence. You can ignore reality, but you can't ignore the consequences of ignoring reality. If you keep looking at the situation like the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power, and no influence, you will be treated by the intensive care team like the 99% of the families of critically ill patients in intensive care. However, if you open your mind, if you start asking the right questions, if you are willing to go against the grain and against what society has wrongly conditioned you to do, if you don't bow down to the perceived power and the perceived authority of the intensive care team, chances are that you will make an impact and get peace of mind, control, power, and influence really quickly. By you asking the right questions, by you being willing to stand up for yourself and for your critically ill loved one, will also quickly reveal to you that the intensive care team has an agenda that goes way beyond your critically ill loved one's prognosis and diagnosis. if you are not willing to bow down to the perceived power and the perceived authority of the intensive care team, if you continue to do your own research, if you keep applying, asking the right questions, and if you are seeking good advice and get peace of mind, control, power and influence quickly, when your loved one is critically ill in intensive care, you will find that there are way too many things in intensive care that are happening behind the scenes and behind the curtains, so to speak. Pay close attention and you will find that intensive care teams are very shrewd and very adept to quote-unquote sell you their agenda and frame it in a way to show you that it might be quote-unquote in the best interest of your critically ill loved one, and yet the intensive care team's positioning is a result of what's happening behind the scenes in intensive care. Now let's dive into part 2 of the IntensiveCareHotline.com 3-part mini-series. What's happening behind the scenes in intensive care is way too powerful to not impact on your critically ill loved one. As I said in the quote in the beginning, if you are like 99% of the families of critically ill patients in intensive care, you don't have peace of mind, you don't have control, you don't have power, and you don't have influence. Period. The fact of the matter is that if you belong to those 99% of families in intensive care, that it's easy for the intensive care team to frame and position your critically ill loved one's admission and stay in intensive care to their liking. The fact of the matter is that if you belong to those 99% of the families in intensive care who have no peace of mind, no control, no power and no influence, that it's easy for the intensive care team to position your critically ill loved one's diagnosis and prognosis to their liking. Why? Because the 99% of the families of critically ill patients in intensive care who don't have peace of mind, don't have power, don't have control and don't have influence, don't question or even ask the right questions in the first place. That makes it easy for the intensive care team to roll out their hidden agenda and frame and position your critically ill loved one's prognosis, their diagnosis, as well as the care and treatment offered or not offered according to their hidden agenda. That's a direct result of what's happening behind the scenes in intensive care. Now, imagine for a minute that your critically ill loved one is in one of the following challenging, heartbreaking and difficult situations where they are either very unstable and in a very critical condition, or they may be in a life-threatening situation. Your loved one may be in an induced coma and isn't waking up. Your loved one may be in intensive care for long-term treatments and long-term stays, including long-term ventilation. Your loved one may be having a severe or traumatic head or brain injury. Your loved one may be in intensive care and may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your critically ill loved one may be in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment could be quote-unquote in the best interest for your critically ill loved one. Or your critically ill loved one may even be approaching their end of life in intensive care. And those situations are exactly the situations where most families of critically ill patients in intensive care need the most help and support. Whenever families of critically ill patients in intensive care find themselves and their critically ill loved one in one of the aforementioned challenging, difficult and often heartbreaking situations, they do one of two things. Number one, if they belong to the 99% of the families of critically ill patients in intensive care who don't have peace of mind, don't have power, don't have control, and don't have any influence. They continue to suck up and bow down to the perceived power and the perceived authority of the intensive care team. Or they do number 2, if they belong to that tiny little 1% bracket of the families in intensive care who get peace of mind, control, power, and influence. They start doing their own research, they start asking the right questions, and they continue to challenge the perceived power and the perceived authority of the intensive care team. Given that you are watching this, I assume you belong to the latter group who is willing to stand up for their critically ill loved one, and I assume you are prepared to do whatever it takes to get peace of mind, control, power, and influence. If you do belong to the latter group, the tiny little 1% bracket of families of critically ill patients in intensive care who get peace of mind, control, power, and influence, you would have also sensed by now that what you see is not always what you get in intensive care. I have written an article about this. What you see is not always what you get in intensive care. You can Google it, or you can click on the link in the written version of this blog below the video. If you do belong to the tiny 1% group of families of critically ill patients in intensive care who want peace of mind, control, power, and influence, you would have sensed by now that intensive care is a very volatile environment with many moving parts, many competing interests, and it's a bit like constantly shifting sand depending on what's happening behind the scenes in intensive care. If you are prepared to do whatever it takes to get peace of mind, control, power, and influence when your loved one is critically ill in intensive care, and if you continuously apply what I teach, you will find that the intensive care team will not be very favorable to you becoming difficult and demanding, and you will find that you standing your ground and applying the things that I teach will reveal that the intensive care team is actually not an environment where you see is what you get. In fact, it's actually quite the opposite. The things that are happening behind the scenes in intensive care are way too powerful to be ignored, and they are way too powerful when it comes to the intensive care team positioning your critically ill loved one's prognosis and diagnosis, as well as the treatment and care offered or not offered. Remember, in part 1 of the IntensiveCareHotline.com mini-series, Critical Lessons for Families of Critically Ill Patients in Intensive Care, part 1, where I talked about that intensive care is a multi-billion-dollar per year industry. This was a lesson about the intensive care environment in general, and as you would have found out by now, the dynamics, the power play, the psychology, the hierarchies, the competing interests, the intrigue, and the fight for limited resources is weighing heavily on how the intensive care team is talking to you, to your family, and to your critically ill loved one. If you are shocked by these discoveries, don't worry about it, because I was shocked too. When I first started working in intensive care in 1999 as a junior nurse, I had no clue about the environment, but it slowly unfolded. Later, when I climbed the ranks and I worked as a nurse unit manager in intensive care for more than 5 years, the light bulbs went on, and I even gained more insights into what's happening behind the scenes in intensive care. And that's what I'm here to teach you today, that what's happening behind the scenes in intensive care is almost always impacting on the intensive care team's positioning of your critically ill loved one's diagnosis, their prognosis, as well as the care and treatment offered or not offered to you, your family, and your critically ill loved one. Funding issues, patients blocking precious, expensive and in-demand intensive care beds, as well as different medical teams often having different and competing interests, all weigh heavily on how your critically ill loved one's diagnosis and prognosis, as well as the care and treatment offered or not offered, is presented to you and your family. It's probably not what you and your family expected, but it's reality. And as I said in the quote in the beginning, you can ignore reality, but you can't ignore the consequences of ignoring reality. Watch out for part 3 of the IntensiveCareHotline.com mini-series, Critical Lessons for Families of Critically Ill Patients in Intensive Care, that I will send out to you in the next couple of weeks. So, how can you become the best advocate for your critically ill loved one, and how can you get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you an in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call us, find phone numbers on our contacts tab on the top of the website. Also check out our product section where you get more ebooks, videos and audio recordings specifically tailored to your critically ill loved one's situation, and where you can also get one-on-one consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.